Raise your hand if you or someone you know has ever struggled to fall asleep at night or stay asleep. As I anticipated, everyone raised their hands. This is called insomnia. Insomnia is defined as when you struggle to fall asleep continually night to night or even staying asleep. And according to the Perelman School of Medicine, 25% of the population struggles with this. Today we'll be talking about the two main types of insomnia, the diagnosis and the treatment. So we're going to start off with the two main types. The first type is acute. And acute insomnia is defined as when it lasts from days to weeks, and it is directly related to stress or other activities. So if you have a lot of assignments going on at school and you find yourself having a hard time falling asleep after you've stayed up so late working on those assignments, that is going to be acute. And the next type we're going to talk about is chronic. Chronic insomnia is going on for longer than 1 month. And chronic insomnia is separated into two main types. The first type is primary. And when you have primary, it is from an unknown cause, which can cause it to be really difficult to treat it. Then the second type is secondary, and that's when there's an underlying medical condition that causes you to have so much brain activity going on that you can't fall asleep. And this medical condition example would be anxiety or depression. So now that you have a basic understanding of the main types, we're going to discuss the process that your doctor goes through to diagnose you with insomnia. The first type of diagnosis that they will go through is asking you questions about your medical history, such as what conditions have you previously dealt with, or even what conditions your family deals with and what gets usually passed down to members in your family. The second thing that the doctor will do to diagnose you is ask you questions about your sleep history. So these questions will include things like what time you usually go to sleep, how many hours you consistently stay asleep, what time you wake up, how long you're awake for, what time you go to sleep, etc. And the third thing that your doctor could do to diagnose you will be to perform a sleep study. And this is usually going to be the last resort as to figure out why you're having trouble falling asleep, because it is a more strenuous type of diagnosis. And this sleep study is just your doctor places electrodes on your head and around your body, and it looks painless, but it's not painful. It looks painful, but it's painless. You can't feel it at all, and you just go to sleep, whether it has to be induced by your doctor or if you just fall asleep. And the electrodes are going to measure different levels in your body, such as your oxygen in your bloodstream, or your brain activity as you're asleep, which is going to show your doctor where the issue might be as to why your brain can't go into a deep sleep mode. And so now that we've talked about how your doctor is going to diagnose you, we're going to talk about the most positive and hopeful part of insomnia, which is the treatment. So there's really three main types of treatments. There are several out there, but the three most common. And we're going to start off with doing a lifestyle change, which is going to be when you have to change the way that you're typically regulating things, like cutting back on some inhibitors. And some inhibitors would include beverages like coffee, alcoholic beverages, or even some medications have a side effect to cause insomnia. And if it is, your doctor finds out that it's a medication causing your insomnia, they'll have to go and look and see what kind of other alternative medications can be used. Another way to use a lifestyle change would be to create a new sleep schedule and continue to follow that. And according to Dr. Sushil Patil, a sleep expert, he says that consistent wake-up times, consistent sleep times, and consistent wind downs like exercise or any other stress type relief like meditation are key in creating a sleep pattern. The second type of treatment is cognitive behavioral therapy. And it is in a small group or one-on-one session with a specialized sleep therapist. And they're going to really focus on what your connotation with sleep is and what you're thinking about when you think of sleep. Are you thinking about something negative like, oh, I'm going to have such a hard time falling asleep tonight? Or are you thinking about it in a positive way, such as, I'm going to go to sleep and refresh my body? And it's really just like a way to reprogram your brain into putting sleep as something that's good for you, not something to be worried about throughout the whole entire day. And according to the National Heart, Lung, and Blood Institute, the specific sleep schedule that comes with cognitive behavior therapy limits the time in bed to only the time that you're going to be sleeping. So you're not just hanging out in your bed all day, which creates your bed as a place that isn't directly correlated to sleep, which can confuse your brain when it is actually time to go to sleep. And this therapy usually goes on once a week for around 2 to 3 months, unless your results come before then. And the third and final type of treatment are going to be medications. There's 2 types of medications. There's prescription and over-the-counter. The prescription are a little bit more risky because you can find yourself having a hard time weaning off of them, and you can become very reliant on them. And it can cause sleepwalking, sleep talking, sleep eating, anything in your sleep that you can think of. And when you wake up, you can feel very drowsy and find a hard time waking back up. Over-the-counter methods are not approved by the FDA, so you take that risk when you choose to use them, and those are herbal teas, melatonin, or supplements. So today we have talked about insomnia and who all is affected by it, and that 1 in 4 Americans deal with it. The types that we discussed were acute, chronic, primary, and secondary. And we also discussed the questions that your doctor might ask in order to treat you, in order to diagnose you, and a sleep study and what it does. And I hope that today, by learning about insomnia, you can further your knowledge with it with someone that you know, or even with yourself, and understand it better. Thank you.